of the abdomen. All muscles of the abdomen consist of lateral muscles, anterior muscle, and it is posterior muscle. We start from lateral muscles. A most superficial muscle in lateral group, that is external oblique abdominal muscle, musculus obliquus externus abdominis. It starts from lower 8 ribs, and inferiorly it's attached to iliac crest. Then inferior free border of this muscle, or more better, free border of tendon of this muscle, has name inguinal ligament, and tendon of external oblique abdominal muscle, it has name aponeurosis of external oblique abdominal muscle, joined with the same aponeurosis from opposite side, and makes white line, linea alba, on anterior abdominal wall. And inferiorly it's attached to the region of pubic symphysis and tuberculum pubicum. That is aponeurosis of external oblique abdominal muscle. And in lower part of anterior abdominal wall, this aponeurosis subdivides into 2 crus, medial and lateral, and they surround inguinal ring, superficial inguinal ring on anterior abdominal wall. In a minute I continue to explain this moment. Now we discuss another muscles. Musculus obliquus internus abdominis, internal oblique abdominal muscle. It starts from iliac crest, from sphenoiliac anterior superior and lateral side of inguinal ligament, goes upward, attached to lower ribs, and continues the same to aponeurosis, that is wide tendon of internal oblique abdominal muscle, and this aponeurosis fused with the same aponeurosis in linea alba, in midline. Next muscle, transverse abdominal muscle. This is and where are deep muscles of the back? Here. Okay. This is transverse muscle of the abdomen, musculus transversus abdominis. It starts both from iliac crest, from transverse processes of lumbar vertebra, from lower ribs, and goes medially and continues to aponeurosis of transverse abdominal muscle, and fused with the same aponeurosis in midline, in linea alba. They are 3 lateral muscles, musculus obliquus externus, internus, and musculus transversus abdominis. Now, 2 anterior muscles, musculus rectus abdominis and pyramidal muscle. Musculus rectus abdominis, it starts from ribs, from 5th to 7th rib, and continues downward and attached to in space between pubic symphysis and tuberculum pubicum. And this muscle separates into some parts with the help of intermediate tendons, intersectiones tendinea. These tendons separate muscle into 1, 2, 3, 4, sometimes 5 parts. That is rectus abdominal muscle. And below of rectus abdominal muscle we have, not in everybody, but sometimes we have pyramidal muscle, musculus pyramidalis. It is small muscle which starts from pubic symphysis and attached to linea alba. Function, flexion in vertebral column, that is move trunk forward. Now, posterior muscle of the abdomen, that is musculus quadratus lumborum. This muscle takes place between iliac crest and 12th rib. Here it is. And main function that it moves trunk laterally to the right or to the left and moves ribs downward. Last rib, it moves it downward. That is the muscles. And now some words about topography. And in this model, impossible to see rectus abdominal muscle. Why? Here it is, we can see it, but here rectus abdominal muscle is absent because it closed with the help of aponeurosis of lateral muscles. Look here, how we can describe it. That is rectus abdominal muscle. That is one, and here it is another. Rectus abdominal muscle, musculus rectus abdominis, anteriorly. And laterally, we have musculus obliquus externus abdominis, musculus obliquus internus abdominis, and musculus transversus abdominis. And here it is the same. External oblique abdominal muscle, internal oblique abdominal muscle, and transverse abdominal muscle. And tendons of all of these muscles, or aponeurosis, that is the same. Tendon, wide tendon, has another name, aponeurosis. Aponeurosis of external oblique abdominal muscle pass in front of rectus abdominal muscle and fused with the same aponeurosis from opposite side. Then aponeurosis of musculus obliquus internus abdominis goes to transverse rectus abdominal muscle and subdivides into two layers, anterior and posterior, and fused with the same aponeurosis from opposite side. And last, aponeurosis of transverse abdominal muscle goes behind of rectus abdominal and fused with the help of with the same tendon from opposite side. And what we receive, that rectus abdominal muscle take place in fibrous sheath or fibrous channel, which forms anteriorly with the help of aponeurosis of external and internal oblique abdominal muscle, and posteriorly aponeurosis of internal and transverse abdominal muscle. And place where all of these aponeuroses fuse together, that is white line, linea alba. Behind of transverse abdominal muscle, we have fascia, that is fascia transversalis, and peritoneum, that is cirrus coat, and peritoneum. This is diagram of vagina of rectus abdominal muscle above of umbilical ring, that is above of umbilicus. Here it is. If we cut anterior abdominal wall in this level, we will see that rectus abdominal muscle has two aponeuroses in front and two aponeuroses behind. If we cut abdominal wall below of umbilical ring, we will see another picture, that is three lateral muscles, external oblique, internal oblique, and transverse. And here it is the same, external oblique, internal oblique, and transverse abdominal muscle. Here it is rectus abdominal muscle, this and this. And below of umbilical ring, aponeurosis of all lateral muscles pass in front of rectus abdominal muscle, and behind only fascia, fascia transversalis, and peritoneum. Fascia and peritoneum behind of rectus abdominal muscle. That is vagina of rectus abdominal muscle below of umbilical ring. Number 1, external oblique abdominal muscle. Number 2, internal oblique abdominal muscle. Number 3, transverse abdominal muscle. Number 4, fascia transversalis. Number 5, peritoneum. 6, that is rectus abdominal muscle. Here it is 6. And 7, that is linea alba. Heat is the same. 1, 2, 3, 4, 5. Heat is 6 and 7. And differences that these 3 aponeuroses take place in front of rectus abdominal muscle below of umbilical ring. And next moment.